one of the nice things about tooth bonding is that it really allows us to minimally go in and fix a tooth that needs work. There's a couple different options with bonding. If you think about it in the sense of I have a cavity that needs to be filled, tooth-colored fillings or bonding allows you to go in and remove that cavity and then fill it. And you basically can do it in such a way that it doesn't look like you ever did anything. We have the ability to take those filling materials, come in tons of different shades, and so we can grab whichever one matches your tooth and go in and fill it. And from that standpoint, it literally bonds to the tooth, and so we don't have to remove any more than what has to be removed, and then we can go in and bond it and smooth it down and shape it, and it looks like your natural tooth. And so from a restorative standpoint, if you have a cavity, that's the way we do that. The other upside to bonding, or the other, I guess, clinical way that we use bonding, is you may have some spacing between teeth that you don't necessarily like. You may have a gap between the front teeth, and you want to go in and close that to where it looks like your teeth come together, and so braces obviously is one way you can go have that done, but that takes a lot of time and a lot of money. So bonding is a way that allows us to go in there, and we use the same tooth colored filling material. We're not really going in and prepping the tooth, but allows us to bond to the surface of the tooth. And then we can take that bonded filling material that matches your tooth and close that gap and shape it. So now looks like your teeth come together in such a way that you want it to look. So a couple different applications for bonding is one that we use it to restore cavities or do fillings. But we also use it cosmetically to go in and close gaps in teeth that were there, and or just change the shading of a tooth. If you don't necessarily like this tooth's a little bit discolored versus my other teeth, can we do anything to fix that? Sure, we can go in and bond over the front of that and smooth it down and match the shade of that bonding to your other teeth and cosmetically change that.